And I'm going to start our recording. So hi and welcome everyone. Thanks for joining us today for our UNC Injury Prevention Research Center webinar series. My name is Ciara Scott and I'm a project manager at the center, and I will be moderating today's webinar. And we will begin today's webinar with a quick welcome from Dr. Steve Marshall, who is the director of the Injury Prevention Research Center. And then he will introduce you all to our speaker for today, Dr. Rebecca Rebbe. And then we will have an informative presentation from Dr. Rebbe, followed by some dedicated time for discussion to answer any questions that come up for you all from the presentation. And then we'll wrap up today with just a brief forecast of our remaining 2 webinars in our series. And so before we get started, I do want to just give a quick housekeeping update that in the first part of this webinar, you all will not have the ability to unmute or enable your camera functions, just so that we can protect the recording from any accidental interruptions. But once we get to the Q&A portion of the presentation, I will enable the unmute function for you so that you can unmute if you'd like to engage with the speaker and ask questions. And also throughout the presentation, if questions come up for you, feel free to just start dropping those into the chat. And as we're going through, I'll be collecting them and in preparation for the Q&A portion. So you don't have to wait until we get there to drop your questions in the chat. You can do it at any point throughout the presentation. All right, and so now I'm going to pass the floor to Dr. Steve Marshall, again, our director here at the UNC Injury Prevention Research Center.
Thank you, Ciara, and I want to take a moment to thank Ciara for her careful oversight and curation of this wonderful webinar series. We hold this webinar on the second Wednesday of each month from 12 to 12:30, and the idea is to showcase the breadth of injury, violence, and overdose topics, and also create linkages between people through this mechanism. We're very excited to have Dr. Rebecca Rebbe with us today. Rebecca is an assistant professor in the School of Social Work. She is the PI of a NIH funded, NICHD funded project on the impact of COVID-19 on child maltreatment. That's an R21. She's currently has a K under review, so we have fingers crossed for you, Rebecca, in terms of getting that. Her work's been published in many leading journals, including Pediatrics and New England Journal of Medicine. And her work is really fascinating. So without further ado, I will hand it over to Rebecca to talk to us about care and support of adult patients with traumatic brain injury and their families across the treatment continuum.
Thanks, Stephen. Appreciate it. Let me take a second and launch my. Can you all see my screen?
Yeah, and I apologize. I think I read the wrong title, Rebecca.
That's okay.
I deeply apologize for that. Rebecca's correct title, somehow I picked up the wrong document. Rebecca's correct title is The Impact of COVID-19 on Child Maltreatment-Related Medical Encounters. That's very embarrassing. And take it away.
Thanks, Steve. Yeah, so thank you to the Injury Prevention Center for having me. I appreciate it. Again, I'm going to be talking a little bit about the impact of COVID-19 on child maltreatment medical encounters and system responses using linked administrative data. There we go. So just a couple of acknowledgements for this work. So first, as Steve mentioned, this study was funded through an R21 by the NICHD. Second, I want to acknowledge my research team for their collaboration on this project, including Emily Putnam-Horstein, Cindy Quelbs, and Jeannie Huang from Rady Children's Hospital, and then Julia Reddy, who's a PhD student working with us. And then finally, this work wouldn't be possible with members from the Children's Data Network who completed our linkages and partnerships with Rady Children's Hospital and the California Department of Social Services, with whom we have data sharing agreements. So a little bit of background. So very early after the onset of the pandemic, there were a number of news articles expressing concern about child abuse, particularly that CPS reports had dropped because kids weren't interacting with mandated reporters and that abuse would go undetected. And there was a specific concern of severe child maltreatment occurring that would result in emergency room visits and inpatient hospitalizations. However, there was very little evidence to support these concerns other than the drops in CPS reports, which were identified across the country. Thus, our study aimed to use linked administrative data to address these concerns. Specifically, the aims of this study were to compare before and after the onset of the COVID-19 pandemic, the rates of child maltreatment-related medical encounters, and two, which of those children who had a child maltreatment medical encounter were reported to CPS. So the most common method of measuring child maltreatment, in at least the most frequent measure, is using CPS reports. But this approach can be limited because it's reliant on people making calls to CPS. And not all kids who are maltreated are reported to CPS. And additionally, as the pandemic demonstrated, reports can be impacted by major social events, such as lockdowns and whatnot, where kids aren't interacting with mandated reporters. So I think that highlights the importance of looking at a diverse set of data to understand the problem of child maltreatment and not just rely on CPS reports. So a little bit about our methods. So first, we had all the medical encounters from Rady Children's Hospital, which for those of you who are not familiar, is a large pediatric children's hospital in San Diego, and serves over a million. It has a catchment area for all of San Diego County and a little bit beyond that. It's the largest children's hospital on the West Coast. And with that, we also had the CPS records, so the Child Protective Services records from the California Department of Social Services, and we linked those together. And we limited our scope to emergency department and inpatient visits for our time frame, which we started at January 1st in 2016 through November 30th of 2021. And that gave us a little, almost 900,000 medical encounters during this time frame. So first, we used ICD-10 diagnostic codes to identify maltreatment-related emergency department and inpatient medical encounters. And we also used some codes that were identified for young children as highly suggestive of physical abuse that were identified in the literature. We ran interrupted time series models to examine how the onset of the pandemic impacted the counts and the proportions of maltreatment encounters before and after the onset of the pandemic. And we used March 16th, 2020, which was the day that schools in San Diego County closed. And then we used logistic regression to identify which children were reported to CPS. So looking at were there different factors that increased or decreased the likelihood that a child maltreatment medical encounter would result in a CPS report. So to the fun part, the results, I'll just a quick note that these are all these results are currently under peer review, and so this subject to change maybe a little bit as we get that feedback back. So this figure presents the total number of maltreatment-related ED and inpatient visits by month. The red line represents the onset of the pandemic, which again we define as March 16th. And as we see that the trend was fairly stable prior to the pandemic with a fairly flat regression line there. But then after the pandemic, we see that there's an upward trend and that there was a peak in August of 2021, which was roughly when we saw the Delta variant surge. We broke these encounters down by the type of encounter. And so the top row is we have both the emergency department and inpatient. The second row has the inpatient encounters, and then we've got the emergency department encounters on the bottom. We see a level change for inpatient maltreatment encounters and an increase in the slope for the emergency department maltreatment encounters. Importantly, the peaks that we observed did not occur immediately after the pandemic onset, but later, again in August 2021, which was about 17 months after the onset of the pandemic. These are the results of the interrupted time series models. And these are presented in relative risks. First, we see that overall, there was an increase associated with the pandemic for both the absolute number and the first set of columns on the left, and for the relative share or the proportion on the second set on the right. Second, we see that across all subtypes, we see increases in the relative share or the proportions, which makes sense in terms of that fewer kids were going to the hospital or being seen in inpatient settings, that those numbers kind of dropped across the board. But then for the counts, we see that there was an increase in physical abuse and that there was an increase in the inpatient encounters for all ages. So we were curious of whether this increase impacted specific age groups more than others. This is a distribution of age categories before and after COVID, the before being in the blue, the after being in yellow. We see here that the infants represented 19% of all maltreatment encounters before the pandemic onset, but then afterwards, they were about a quarter of the maltreatment encounters. So we took a look specifically at infants after identifying this change in the distribution. So similar to what I showed you previously, this is the distribution or the counts by month by the different encounter types. So again, the top is both inpatient and emergency department, followed by inpatient in the second row, and then emergency department. So theoretically, we could think that parents of newborns were particularly impacted by the pandemic, given the interruptions in services and well-child doctor visits. The feelings of isolation, particularly given the vulnerability of infants and not having access to vaccines, and then just the general stresses of having a new baby. And we see here that overall, we see a step change in the count of inpatient visits and what appears to be a slope increase for ED visits. And then when we look at the interrupted time series models, again, we see that there are significant changes associated with the pandemic for both absolute number and the relative share. So both of these were found to have increased. Again, the relative share or the proportions increased across the board. But then when we look at the counts, we see that physical abuse, emergency department, and inpatient encounters all increased with the onset of the pandemic in these models. So for context, we looked at a couple of different indicators. So and for each of these indicators, we calculated first the average number for a calendar month for the years 2016 through 2019. And this was to give us a little bit to identify if there was some seasonality in terms of month to month, if there was differences in terms of each of these outcomes. We then found the percent difference for each of 2020 and 2021 for a given month with the average between 2016 and 2019. And here those differences are plotted for 2021 and 2021, for 2020 and 2021 for all ED inpatient encounters, which is the red line. We have for the encounters with a maltreatment diagnosis, that's the blue line, and then the count of all infant CPS reports for San Diego County, and that is our orange line. And we see that after the onset of the pandemic, all medical encounters, that red line, and all CPS reports regarding infants, the orange line, were less than the averages for 2016 through 2019. In contrast, the medical encounters with a maltreatment diagnosis were above these averages for the majority of the months in 2020 and 2021. And then there was one other thing that we were interested in, particularly given the results regarding the infants, is that we looked at the count of emergency department and inpatient medical encounters that had diagnosed fractures generally, and then also for skeletal surveys for kids under the age of 3. So skeletal surveys, for those who aren't familiar, are a set of x-rays of a child's entire body to see if there are any fractures that may not be obvious or if there are any healing fractures. These are very important tools in the examination of physical abuse. And here we see a sharp increase in the number of first skeletal surveys completed for children after the onset of the pandemic, and following an upward trend that we see until September 2021. This contrasts with the diagnosed fractures, which were lower after the onset of the pandemic that we see in that lower row. Okay, so moving on to our second aim, and we're looking at which kids who had an encounter with a diagnosis of child maltreatment, which ones had an associated CPS report. So we calculated the percent of maltreatment medical encounters with a CPS report during the medical encounter. Before the pandemic, the average percent of maltreatment encounters with a CPS report was about 75.8%. For the 3 months after the pandemic, so those first initial months, it was over 90% of the maltreatment encounters that were reported to CPS. And then we see over time that those numbers went back down to those pandemic levels, somewhere in that like 75-ish percent. So these are the results of our logistic regression model to see what the outcome of a CPS report during a maltreatment encounter. And we controlled for a variety of encounter level and child level characteristics. And we found that encounters related to physical abuse and that occurred after the pandemic onset were more likely to be reported to CPS than encounters related to neglect or psychological maltreatment, or those that occurred prior to the pandemic onset. And in this figure, the odds ratios that have a number above them are statistically significant, and those that do not have a number are not statistically significant. Okay, so what are some of the implications of these findings? I am going to discuss 3 here. First, we did observe increases in the counts of maltreatment medical encounters, particularly for infants and for inpatient encounters. Second, we observed that the percentage of children reported to CPS was higher relative to the time period prior to the pandemic onset. This suggests a change in the reporting behavior with the pandemic, which may be associated with the stories in the media or voice concerns about maltreatment, or a higher, or it could be also related to that the encounters were more severe in nature, or impacting a more vulnerable group being infants. And then third, the observed increases of encounters diagnosed with maltreatment did not occur immediately after the onset of the pandemic, but later, particularly in that second year of the pandemic. And this may explain why some other studies have not found increases. Their observations window were frequently a lot smaller and focusing on that initial time period right after the pandemic. It's also possible that we observed an outlier in terms of the summer of 2021. And so I think that we really need more data to understand what happened in terms of child maltreatment and the pandemic. There's a number of limitations to consider with this study, and here are a few. One, we limited this to a single medical center, and so it is unknown if the trends that we identified for this medical center in San Diego translates to other jurisdictions. And then second, there's a large amount of information that medical professionals consider when making decisions in terms of making a diagnosis of child maltreatment or making a report to CPS, and this study did not have access to many of those factors. And I will pause there and happy to take any questions or comments that you all may have.
Thank you so much, Dr. Rebbe. Or sorry, Rebe.
It's okay.
I am going to change the settings now to allow folks to unmute. And so if you do have questions, you can feel free to drop them into the chat. Or if you'd like to verbally ask your questions, if you could just use the reactions feature to raise your hand, and I can call on folks. Claire, you can go ahead and ask your question. Okay. Try it now, Claire. All right.
That's working now.
Okay, perfect.
Okay, so I was just curious about, I don't really know much about how like diagnostic codes are assigned. And I was curious if it's like possible that medical professionals were more aware of child abuse somehow because of it being in the news, or like these concerns about drops in reporting being in the news, and maybe their reporting habits changed and that's reflected in part in your results, or if there's a way for you to test for whether that was part of it or not.
Yeah, that's a great point and great question. I think that I'll start with the second part first. Is no, I don't think that we have a way of kind of really drilling down and understanding, what, at least in this, big population-based data, of how those decisions were being made. I think that I'll caveat that a little bit with saying that's partially why we looked at skeletal surveys, was because they are such an important tool in identifying maltreatment, or specifically physical abuse, to see if there was changes in those tests. But I think that the consciousness in terms of why we're was the narrative that was going around in the news about child abuse increasing in both counts and severity while CPS reports were going down. I think that is a very possible explanation for some of the changes that we see in the reporting, where it makes logical sense that a physician may feel more of an obligation to make a CPRS report, knowing that the kids aren't going to be seen by anybody else, and that they're kind of like they're the only ones, versus during quote unquote normal times when they may feel like there's other safeguards around. So I think that's definitely a very plausible explanation.
All right, and we have another question from Des Runyon. Des, you can feel free to unmute, or I can ask the question that you dropped in the chat.
Des, can you hear us okay?
Okay. It should be working, but in the meantime, I'll ask the question you dropped in the chat out loud. So Des has asked what happened with neglect reports from the hospital.
Yeah, so neglect's kind of this weird piece in that, so there are two different, for folks who don't know, there's two different sets of ICD-9 code, or ICD codes, that have been used recently. ICD-9, which was used prior to 2016, and then ICD-10, which was used after 2016, which is why we started at January 1st, 2016. In ICD-9, there was no like specific diagnosis related to neglect. And so in the literature, lots of folks, including myself, had used a whole bunch of other codes to kind of identify neglect and there were often things like accidental burns or drug ingestions or things of the like. ICD-10 improved on ICD-9 in that it included a neglect diagnosis. But what I have seen thus far in data that I've looked at is that there are very few diagnoses of neglect. And so one of my thoughts is that it's because it's a new diagnostic code that physicians aren't using it. And so all that is to say is that there were very few cases of neglect that we found in this data set. And so it's a little hard to kind of tease out where those cases might be. Hopefully that answered that question.
I might add that typically as a physician, I don't put the code in directly, but the hospital has other coders that do it that are kind of immaterial to my level, my suspicion. They look at my record and see whether I've suspected it or not. I actually think that given that families were at home, maybe with more than one caregiver, that there actually may have been a decline in neglect, but that physical abuse and sexual abuse may not have seen the same changes. So the patterns might evolve.
Yeah, I think that's definitely a plausible, there were more adults around, so definitely plausible.
It looks like we also have a question from Anna. Anna, are you able to unmute?
I think I am. Can you hear me?
Yep.
Great. I just wanted to follow up on what Des said. He's correct. If you're using administrative data, those codes are assigned by professional coders based on what's documented by the clinician. So if the clinician documented that they suspected neglect, it should get coded because they are very good at using the codes available. But yeah, I mean, if it's not documented during the visit by the clinical provider, they don't have anything to code. So I think the lack of neglect codes is related to it either not being documented or, when it was suspected, but that's probably unlikely. So I think it's probably that they were seeing less suspected neglect because it wasn't getting documented and coded.
Yeah, I think that, this is kind of this mystery piece for us admin data researchers of figuring out the coding piece. I will also say that prior studies have identified that child maltreatment is undercoded in records. So all of this is actually probably an undercount.
All right, so we are coming up on time. It looks like we have about one more question in the chat. So what I'm gonna do is just wrap us up, and then Jess and Alex, if y'all have the option to stay a little bit after to talk with Dr. Rebbe about your question, I'll give the option to do that. I'll leave the room open. But just to quickly wrap up, first of all, thank you again, Dr. Rebbe, for your wonderful presentation. We're really happy that we were able to have you today. And as I mentioned earlier, we have 2 remaining webinars in our webinar series. So our next webinar is going to be in April, on April 12th at the same time, 12 to 12:30. And during that presentation, we're going to be featuring a researcher from the IPRC. And then following that, our final presentation will be on May 10th. After this webinar, I'll be sending a follow-up email with details about our next webinar and a link to an evaluation survey that we'd love for you all to complete if you are able to. I'll also share a link to our website where you can find more information about our webinar series and find a link to the presentation recording, which will be available about a week from today. So thank you all again. For those who have to hop off, feel free to do that. We are at 12:30. And then I will just share this last question with you, Dr. Rebbe, which, so Jess said that she wonders if there was an environmental shift, like a decrease in financial or social supports for families of young children in August of 2021. And then Alex just followed up, agreeing and wondering about economic impact payments and tax credits in particular.
Yeah, that's a great point, and something I think we bring up in our papers, but that hypothesis is that the financial COVID payments that were, the grants that were handed out to everyone stopped just before that period of time. And so I think the combination of like the lack of it is possible that the fear that the pandemic was not over. Again, this was around the Delta variant kind of taking off and being a really big problem. And I think concerns of like a reality checking that the pandemic was not over, combined with the support, the financial support that had been provided by the government ending, could have resulted in some severe stresses for families. Hard to know. I want to see more data for more jurisdictions and for a longer period of time, but I think it's important to keep that in mind as an important factor that could be in play here.
Well, thank you so much for hanging back to answer that question, and for those who did stay back. I'm also going to share Dr. Rebbe's contact information in the follow-up email that I send. So if anyone wants to follow up with her directly and continue the conversation, you'll definitely have the option to do that.
And
All right.
Rebecca, I assume you're connected to some of the people who are on the call here, like Diaz Runyon. But if not, we can certainly make the connection.
I have actually never met Des, but I know his work. So yeah.
Okay, well, he's if he's in town, he's not far from us. He's just a few miles down the road from me. And it's great to see you, Jess, IPP fellow. Thank you for joining. And thank you everyone for joining. Rebecca, here's the truth. I guarantee there's not one single thing that was not altered by the pandemic.
Yes.
And I suspect that for some children, mistreatment was more evident because they were sequestered at home with their abusers. But for other children, people who otherwise might have had access to them did not in an unsupervised manner. But I definitely think the pool of undetected cases and the severity of undetected cases in the pool probably shifted for multiple reasons. Like more resources, more awareness, but also I suspect things got worse for the kids who were at highest risk.
I agree. And I think, I think it's also important to remember that not just schools closing, but all of the preventative services that are in place, like home visiting or stuff like that, all of those things either stopped or shifted or whatnot. And I think, again, for those really young kids, getting to even just have child visits, probably stopped. And so all of those kinds of layers could have an impact.
Yeah, I saw someone mentioned daycare.
Yep. Huge. Right. Yeah.
I'm going to hop off. Yeah, thanks a lot, Rebecca. And your work is really important, as you well know.
Well, thank you. I appreciate it.
Thank you, everyone. Bye.